Yeah, I can tell you that also we run into problem with patients coming in and they think, well, this is bad patient experience. Sometimes we think that maybe we're telling patients that how do you say, we're raising patients' expectation too much. All right. So when you have a certain expectation, when you go into a place, if that expectation is not being fulfilled, you'll feel bad. So that's one. How do you call it? It could be a bad strategy that we was keep telling that in Hong Kong Sanatorium we'll try our best to exceed your expectation. And when the patient comes in the hospital, they have full of expectation, and they would tell you that what you promise is not true. I have to go around sometimes to talk to patients when they have, you can say, complaints. Some are not really, some are reasonable complaints, like, we walk into a washroom and it is not as clean. We expect a hospital to be really spot clean. But obviously when she might be walking into the washroom while another client has been to the washroom, but the cleaner has not been there quick enough in between. So it's a hospital. It's difficult to control, especially in a maternity ward that you have mothers who just delivered, and obviously they might be bleeding, and then you have problems like that. So we go around and talk to them, and we'll promise that we improve. And I think important thing is to show that we care whenever a patient complains of the experience, and we'll try to assure them that we'll take their comment and go ahead and improve ourselves. I think especially when patients actually took the time to notice what's wrong with the service and tell us. I always thank them for taking the time to do that. Otherwise, what they could do is just turn a blind eye and go away and talk badly about their experience in the hospital. I think they're free to do that, and quite easily they do that. And the very fact that they bring up what they see, and they tell us what is wrong with the service, actually help us to improve the service. So when a patient had a bad experience and they tell us, I think it helps us to improve. It's only when the patient have a bad experience, they don't tell us, they walk out, and that is bad. Okay, so we'll try to train our staff to go around the hospital to talk to patients and to understand what their needs are. We also have a weekly round by the executive from the administration to the hospital and talk to patients and ask them about what the experience in the hospital is like, both in the medical treatment and the experience in like food, like temperature, like noise, like environment, like what they want to see in terms of improvement, like the IE buddy we have, what sort of program they would like to see when they're in the bed. So this goes around once a week. Not to all the patients, of course. They just go around and pick a few patients randomly and ask them about their experience. So that helps us in improving. I mean, it's unavoidable to have someone with a bad experience, but we try to catch that and understand why they have a bad experience and improve on it. It's like a continuous improvement. That's how we could improve our patient care in the hospital.